Good morning, everyone from New York. We have a wonderful program set up for today. We're dealing with the issue of challenges facing governance in the era of the coronavirus. So, of course, there are many stakeholders involved and drawn into this crisis: healthcare workers, essential workers who keep the supply lanes open for food and water and basic necessities. Our focus today, however, is more on the role of governments who have a special responsibility to address issues of the security and well-being of citizens. As we see 24/7 on the news cycle, the governments are being evaluated. Some are getting high marks and some are not getting all straight A's. And there are a number of criteria by which governments are evaluated: their preparedness, how much emphasis was given to preparedness for pandemics, issues of responsiveness, how quickly did governments respond to the crisis? Who knew what and when did they act? Another area has to do with transparency and being forthcoming about data accurately. This has also been an issue. Of course, that's related to testing, but then on the foundation of testing, the accuracy of testing. There's also a lot of discussion about the impact economically, a global recession that is disastrous. Some ask, is the cure, namely social distancing and lockdown, is the cure worse than the disease? In this country, you hear discussions about deaths from despair, that there are unintended consequences of policies where there's higher rates of drug abuse and alcoholism, mental health issues. So governments are being looked at. They're also being noted when we identify best practices. We hear about South Korea in particular. We hear good news from Sweden. So we have a great set of panelists here, very distinguished. They will each speak from their own area of expertise.